Hello, everybody. Today we're going to talk about the topic of post-traumatic growth in cancer patients. As you can see by the outline, we're going to cover multiple topics within this today. We're going to start with an introduction. We're going to talk about post-traumatic growth, cancer in general, our population of interest, the relevance of studying cancer survivors. We'll look at a cancer survivor story, variables associated with this topic, different treatment modalities, the role that spirituality plays in post-traumatic growth with cancer survivors, future possible topics of research, and then wrap everything up at the end. So why post-traumatic growth in cancer patients? According to the American Cancer Society, in 2025, there will be 2,041,910 new cases of cancer in the United States alone. Cancer is a life-changing experience for those who are diagnosed with it, and typically for their loved ones. This presentation will explore post-traumatic growth that can occur for individuals who have been diagnosed with cancer and what can help facilitate this growth. Survivors of trauma in general report post-traumatic growth at a rate of 58% to 83% following trauma. This is also true for cancer patients. Yet there was no difference found since the time of diagnosis and the amount of growth experienced for cancer patients. Some research found that post-traumatic growth, or PTG, can occur as early as 2 weeks to 4 months, and others say it takes many years to develop. Several studies have shown that PTG is strongest within 2 years of the cancer diagnosis. What is associated with the amount of growth is the more advanced a person's cancer, the stronger the association with growth. Stage 4 cancer patients have the strongest growth potential. In 2021, Gorey and team conducted a study with 154 diagnosed cancer patients. They were studying what part resiliency, personality, and coping skills played in post-traumatic growth. PTG was predicted by level of resiliency with different coping strategies as measures. The higher the level of resilience, the more positive the patient's attitude. They feel that implementing skills-based training for resiliency and coping strategies could help promote PTG in cancer survivors. This shows how important resiliency is in promoting growth. And we'll look at this more as we get into our slides. Looking at post-traumatic growth in cancer patients is important because cancer is the leading cause of death worldwide. In 2020, it accounted for nearly 10 million deaths. The majority of people in the world will be touched by cancer in some way. The way cancer is viewed has changed due to advances in treatment and early detection. It is often seen as a chronic condition that is manageable. Due to this fact, living with cancer long-term makes it even more vital that therapists are able to help patients with post-traumatic growth. In the United States alone, the number of cancer patients each year is growing due to the aging population and the advances in treatment. Cancer is no longer considered a death sentence, but a condition that many people live with throughout their lifetime. It is important to note that the terms cancer patients and cancer survivors are interchangeable in literature and when looking at research studying post-traumatic growth for cancer patients. Both terms represent people living with cancer. There are multiple risk factors for cancer patients that can impede their post-traumatic growth. According to the American Cancer Society, having a prior history of anxiety or depression, having an extensive history of trauma prior to your diagnosis, being diagnosed with cancer at a young age is a risk factor, and not having a good support system in place is another risk factor. Also, a risk factor is PTSS and PTSD. A high number of cancer survivors experience post-traumatic stress symptoms. These include avoidance, numbing, helplessness, and intrusive memories. Some survivors experience PTSD and the heightened symptoms that come along with that diagnosis. The symptoms with these are a definite risk factor for cancer patients. One significant risk factor is trauma centrality. It is something cancer survivors often experience. It occurs when a diagnosis that is a significant life event, like cancer, for example, becomes central to one's identity. This is associated with both PTG and PTSS. Centrality scores can be assessed with the centrality of events scale. It assesses the extent to which a negative event becomes central to one's identity, or becomes a turning point in their life story, or they use it as a point of reference for interpreting everyday life experiences. Centrality scores are higher in people who have experienced cancer. Both positive and negative outcomes in cancer patients are predicted by the centrality of the disease. PTSS and PTG are often considered a double-edged sword because they usually happen simultaneously. Interestingly, females consistently report higher event centrality than males. Another significant risk factor is fear of cancer recurrence, or it's called FCR. FCR is influenced by intrusive thoughts, anxiety, and worry in that order. Intrusive thoughts are indicators that a patient is not adjusting well to their diagnosis or life after cancer. These thoughts are central to FCR. When looking at anxiety, the greater the risk of their cancer coming back, the higher their anxiety levels. Worry are the thoughts that keep patients focused on negative things and really impacts their quality of life. FCR impacts in a negative way the quality of life of a patient. The negativity they feel colors everything around them. It impacts their emotions in a negative way, and it keeps them from making future plans. The anxiety surrounding their sense of impending death, or that their cancer is coming back and they're going to die from it, causes them to question things like, what is the meaning of my life? Or why should I plan that vacation next year? I might not be here anyway. Things of that nature. Studying cancer patients is relevant because it's a global health issue that continues to increase in numbers. As therapists, every year clients come in that are being impacted by their own cancer or assisting a loved one who has cancer. Understanding how to help promote post-traumatic growth for cancer patients is important for understanding the best way to help them. When cancer patients have increased levels of post-traumatic growth, they are found to have better quality of life, more positive emotional states, and are able to psychologically adapt better. They have lower levels of anxiety, depression, and post-traumatic stress. These are all things that therapists are seeking to help their clients achieve. Let's take, for example, the story of Alice Mae Purkis. At 26 years old, she was diagnosed with breast cancer. She did view cancer as a trauma and experienced post-traumatic growth and change due to it. She did not experience post-traumatic growth immediately. It took years before she felt like she made that growth. She shared that part of the reason it took so long was that pressure was put on her from the initial moment of diagnosis to be grateful. She did not feel grateful immediately, and feeling like she was not doing something she was supposed to hindered her growth. Once she did experience it, her priorities shifted and she focused less on work. She began to focus more on her spiritual life. Her compassion increased, and she felt that when things in her life were not going right, she changed them more quickly than she previously had. Her story emphasizes that therapists have to meet the clients where they are in their journey. The pressure to feel positive so quickly slowed her post-traumatic growth down. There are many variables to consider when discussing cancer and post-traumatic growth. Comorbid conditions, the relationships between PTSD, PTSS, and PTG, the factors that positively impact post-traumatic growth in cancer survivors, And then the benefits of using a meaning-making model is shown through research. All of these factors need to be taken into consideration when working with clients who are cancer survivors. FCR comes with many comorbid conditions for cancer patients. A few are anxiety disorders, stress-related disorders, depression, and subclinical distress. If you think back to what we talked about with FCR, the intrusive thoughts, the anxiety and the worry, all of these comorbid conditions coming from that being experienced for a prolonged period of time match and make sense. When looking at post-traumatic growth, the relationship between it and PTSD or PTSS have to be considered. There are 4 possible relationships between them: positive, negative, curvilinear, association, or no association. A positive relationship entails patients reprioritizing and rebuilding values that were broken by the trauma. In a negative relationship, growth is difficult due to overwhelming symptoms of PTSD or PTSS. A curvilinear relationship is neither positive or negative, and no association means they are separate entities with no common predictors. Fortunately, research shows that the relationship for cancer patients is typically positive between PTSS, PTSD, and PTG. In 2021, a study was conducted to look at factors affecting post-traumatic growth. 154 cancer patients were given several scales and inventories: the post-traumatic growth inventory, the impact of scales event, the Connor-Davidson resilience scale, and the 10-item personality inventory. When analyzing all the answers on the scales and inventories, researchers found some predictive factors for post-traumatic growth, and they discovered positive factors for post-traumatic growth. Two factors were found to be predictors of experiencing post-traumatic growth: a positive attitude and remodeling. These 2 factors aid the individual in the development of a new outlook on the world and life. They see value in their experience. When interventions are put in place that focus on these factors, like resiliency and coping strategies, reports of higher quality of life occur, and there is a decrease in psychological distress and comorbid conditions. There are several factors that positively influence post-traumatic growth. One is resilience. In cancer patients with higher resiliency levels, research has shown that they have better coping strategies, better quality of life, and they are more likely to follow therapeutic recommendations. They even have better mental health overall. Focusing on resiliency would be key to helping clients. In a study done in 2022 with 111 cancer patients, researchers used a religious coping scale, a resilience scale, there's resiliency again, and a post-traumatic growth inventory to measure factors that impact PTG. Several factors were discovered. Post-traumatic growth outcomes were found to be impacted by religious coping, personal traits, and stress management. Religious coping, like prayer, worship, and gratitude, positively impacted PTG. Patients had lower anxiety and had improved moods and took better care of themselves when they were able to use religious coping skills. It also enabled patients to change their negative feelings into a more positive outlook. Personal traits like extroversion, hope, and optimism had positive effects on PTG, as did having good stress management skills. This same study also found that the ability to express feelings, resilience, once again, and sociocultural characteristics influenced post-traumatic growth. Being able to express your feelings helps manage affect. Patients with good resiliency had lower levels of anxiety and depression. Resilience is a protective factor against mental distress, and those patients had more life satisfaction and actually had less side effects from their treatments. Cultural background also plays a part in PTG. If patients are part of a culture where family and friends are central and supportive, and there's a belief in religion and life continuing, then their post-traumatic growth is positively influenced. When assessing post-traumatic growth scores, higher scores were also impacted by several other factors. Patients without children have higher PTG scores. If they were diagnosed in more recent times, they also have higher scores. Due to the fact that cancer is viewed differently and is, as we discussed previously, often seen as a chronic condition and not certain death. And there are so many more treatment options in current times than there used to be. Research has also shown that the higher their knowledge about their disease, the higher their post-traumatic growth scores. Healthcare workers and therapists need to be mindful that the more knowledge a person is given as early as possible in their journey, the more likely they are to experience PTG. Researchers have found that using a meaning-making model is beneficial due to the discovery that meaning-making is closely connected to experiencing PTG after a cancer diagnosis. Meaning-making helps people make sense of the world through searching for meaning to make the trauma fit into their worldview. It helps patients modify their priorities and goals when confronted with the trauma. One technique used in a meaning-making model that was found to benefit cancer patients was expressive writing. It helped to increase their post-traumatic growth. It also increased their positivity towards the meaning of life and decreased depression. In this writing, patients are encouraged to express deep emotions and thoughts connected to the event. This technique promotes physical and psychological well-being. Using a guided disclosure protocol in a meaning-making model helps push the expressive writing even further when processing trauma. In a guided disclosure, patients go past just the emotional aspects of expressive writing. They're encouraged to write in detail about the events of their trauma. They are to look at past, present, and future impacts of the trauma. This is to help them not just process the emotions, but to cognitively process the events. Some research suggests the best time to implement post-traumatic growth interventions is after the conclusion of cancer treatments. The belief is that the patient will be more attuned to the experience and be able to appraise important changes. Therapists will want to encourage self-regulation, active coping skills, and cognitive restructuring. At the same time, discourage avoidance because that is usually associated with PTSS and PTSD symptoms. There are several treatment modalities that have been researched to determine if they are beneficial for helping cancer patients experience post-traumatic growth. One such treatment that is a meaning-based psychotherapy is logotherapy. This approach helps individuals understand the value of their existence and find life direction when facing challenges. This helps increase PTG and decrease death anxiety. In a study conducted in 2024, cancer patients experienced a 58% decrease in anxiety related to dying. Life expectancy was positively influenced by logotherapy. Other meaning-based psychotherapies that could be beneficial are managing care and living meaningfully, which is a cancer-specific psychotherapy model meant to help people cope with the challenges of advanced cancer. Also, mind mapping is a brief meaning and purpose therapy for cancer patients to review their life to help with post-traumatic growth and meaning and purpose. Supportive psychotherapies have been found to have many positive impacts when working with cancer patients. They help facilitate the patient's adjustment to their new reality. Staying engaged in life is important, and they have been found to help sustain that engagement. Patients being able to express and regulate emotions is important, and supportive psychotherapies help with regulating their affects. It can also help lessen the anxiety and confusion derived from their trauma. One supportive psychotherapy is mindfulness. Mindfulness as a treatment modality is not meant to block out unpleasantness, but to feel thoughts, feelings, and sensations in a non-judgmental way in the present moment. A study was conducted to look at the impact of mindfulness-based supportive psychotherapy on post-traumatic growth, self-compassion, and specifically the post-traumatic growth of cancer patients. Significant improvements were found in all three areas. The techniques used in mindfulness were found to reduce depression and anxiety symptoms. One of the most effective treatments with FCR is CBT, or cognitive behavioral therapy. Intrusive thoughts are the most influential symptom of FCR, and CBT helps reframe these thoughts. Spirituality plays an important role in the post-traumatic growth of cancer patients. Cancer causes people to question things existentially. Religion and spirituality assist people in understanding their opinions and feelings about the situation in a positive way and in dealing with the questions they have about cancer. Using prayer and combining it with religious beliefs increases people's feelings that God is going to help them. There is a direct correlation between an increase in post-traumatic growth levels when there is an increase in religious beliefs. It would be beneficial for patients if healthcare providers were mindful of the spirituality and religious concerns of patients when treating them. A study conducted in 2021 with 200 cancer survivors confirmed that religious beliefs and post-traumatic growth are related. Higher levels of PTG were found in cancer patients that were religious versus cancer patients that were non-religious. People who have intrinsic religiousness find coping with traumatic events easier because they find meaning in life through their religion. They often view their illness as deepening their faith. They believe that the illness has made their faith stronger, and they are given hope and grounding through their faith. When looking at the post-traumatic growth model, there are 5 domains: personal strength, relating to others, new possibilities, appreciation of life, and spiritual and existential change. Growth in personal strength helps patients look at themselves as not victims, but survivors. The quality of their relationships helps promote greater compassion and empathy and a need to help other people. Some develop new interests or find new life pathways. When developing an appreciation of life, they begin to find more intense sense of value in even the smallest moments. Growth in spiritual and existential ways help them develop meaning in life and strengthens their religious beliefs. When looking at these 5 domains, gratitude is related to all of them, but has the strongest relationship with spiritual change and relationships to others. Gratitude has a strong connection to post-traumatic growth. This link between gratitude and spiritual change is strong in people who have religious beliefs. Researchers found that people who live their faith on a daily basis, which includes gratitude, are predicted to have higher levels of post-traumatic growth. There are several areas that can be looked at for future research opportunities about post-traumatic growth in cancer patients. One area that needs more research is identifying factors that influence PTG for cancer survivors. These factors are important because they can be incorporated into therapies. Also, identifying the factors that hinder PTSS and other negative outcomes should be studied to help therapists assist clients. FCR is another area that needs further study. The intrusive thoughts that come with FCR play a direct role in the post-traumatic growth a cancer patient makes. Intrusive thoughts were found to be a bridge between nodes for triggers and psychological distress. Disrupting the pathway of intrusive thoughts could possibly be the link to reduce that psychological distress. Clinical trials in the future should focus on intrusive thoughts and other rapid thinking patterns. Self-report measures are a common way to collect information in studies with cancer patients. More research needs to be conducted using trained clinicians to administer questions versus self-report measures. Self-report measures are sometimes mentally exhausting for patients to fill out and recall all of the information being asked of them. More clinical interviews could be used, like the clinician-administered PTSD scale, to alleviate some of the mental strain and get accurate responses. Also, a longitudinal study would be beneficial to track how post-traumatic growth changes over time. The majority of studies for cancer patients are cross-sectional. In conclusion, it is evident when looking at statistics, cancer is a global issue that has far-reaching impacts. In recent times, it has been considered to be a chronic condition that people are living with for a lengthy period of time. Understanding the factors that can help promote post-traumatic growth in cancer patients is essential to being able to provide effective treatments for clients. Having the knowledge that cancer survivors can struggle with their spirituality at times due to possible anger towards God about their situation, and helping them navigate these issues is important because evidence shows that leaning into religion and prayer helps promote that growth and helps find meaning in life. Statistically speaking, the majority of us will encounter cancer on a personal or professional level during our lifetime. It is our duty as therapists to equip ourselves with the knowledge to help people to the best of our ability.